Hi, everybody. Happy Wellness Wednesday. I'm so happy to have you all here with us today. My name is Jyaer Powell. I'm the Community Health and Development Coordinator, and I'll be presenting over the impact of HIV on Black women. Know your status. So, who are we? We are the Centers of Wellness for Urban Women. We empower women and their families living in urban communities to take action in their health and well-being through education, advocacy, prevention, and care. We believe in wellness for everyone, no matter the race, gender, age, everybody. So, CWU and the End the HIV Epidemic Initiative. The End the HIV Epidemic Initiative is a national movement launched in 2019 to reduce new HIV infections by 90% by 2030. It focused on four key strategies: diagnose, treat, prevent, in response to HIV. As part of Mary County's End the HIV Epidemic Initiative, CWU is implementing a comprehensive approach to support Black women. This includes HIV prevention education, expanded testing access, and wrapped around services that address key social determinants of health. By integrating A1C and blood pressure screenings, rapid HIV self-test kits, and culturally sensitive education, CWU normalizes HIV testing and promotes overall wellness. Through this initiative, CWU reduces stigma, encourages regular screenings, and empowers women to take charge of their health. So, the virus. What is HIV? HIV is a human immunodeficiency virus that can lead to serious health conditions and even death. HIV 1 is the primary global style, and if left untreated, will typically lead to death within 8 to 10 years. HIV 1012 occurs mostly in West Africa and has a slower clinical progression. Routes of transmission. HIV transmission occurs when fluid that contains HIV enters the body of a person without HIV, primarily via mucous membranes or bloodstream. So I usually get a lot of questions about how HIV can be transmitted. One of the recent question was like, this lady was scared to go get a pedicure because she was scared. They don't clean the utensils. And what if someone had HIV, the blood got on the utensil, and then they used it on her? And I tried to explain how HIV virus is killed as soon as it hit the air. So even if that person did have HIV and the lady and whoever did not clean the utensils before, it will not transmit to you because it's killed by the air before it gets to you. So usually HIV can be transmitted by sexual contact, sharing needles to inject drugs, during pregnancy, birth, or breastfeeding or chest feeding. Fluids that can transmit HIV is blood, semen, pre-cum, rectal fluids, vaginal fluids, and breast milk. HIV is not transmitted by air or water, saliva, sweat, tears, or like closed mouth kissing, infected pets, sharing toilets. I also get that a lot about sitting on the toilet with someone who might, pee on it and they have HIV. You would not get it by sitting on that toilet. Food or drinks. So, HIV infections among women. This is the statistics on how it affects women in the United States. So, on the blue side, you have the population of women, and on the purple side, you have the diagnosis. So, if you look at Black/African American women, you see that we only make up 13% of the population, although we make up 54% of the new diagnosis. With that being said, Black women are disproportionately affected by HIV in the United States. In 2022, Black women accounted for 50% of the new HIV diagnoses of women. Factors that contribute to HIV cases among women: lack of access to PrEP, stigma, lack of access to health care, and criminal justice system involvement. With that being said, PrEP is for us. So you can take charge of your sexual health by getting on PrEP now. PrEP is for women. So, what is PrEP? PrEP is a medicine that's highly effective at preventing HIV when taken as prescribed. PrEP can be taken as pills or shots. PrEP is safe for women to take and can even be taken during pregnancy or breastfeeding. So, stigma, what is the definition of stigma? Stigma. The dictionary says that it is a set of negative and unfair beliefs that a society or group of people have about something. It can be a mark of shame or discredit, like a stain. We are talking about stigma in regards to people living with HIV, commercial sex workers, survival sex, substance use disorder, people experiencing homelessness, or sexual active people. So what can be formed? What can be done? You can stay informed, talk openly about HIV, normalize the subject, provide opportunities to educate, and clear misconceptions. You can know knowing your status can help you get treated earlier, which can prevent HIV from progressing to AIDS. Knowing your status can also encourage previous partners to get tested. This will also help with the stigma around HIV to protect our community from HIV. As CWU, sexual and reproductive health is a vital part of our overall wellness. We will be providing HIV, STD, and viral hepatitis education to empower informed choices. We'll also be providing rapid testing at events for easy access. And you receive a $10 Visa gift card if you are tested and referred by CWU. So thank you, everybody. If you are interested in learning more information about our In the HIV Epidemic Initiative, please and type in other at the end. Also, if you're interested in any of our events that we'll be providing testing at or just, want to see what we got going on, please scan this QR code to stay in the loop. Thank you guys again. Happy Wellness Wednesday. My name is Jyaer Powell. I am the Community Health and Development Coordinator. I am so happy that you guys were able to stop by and listen to